Good afternoon, everyone. Thank you so much for joining us. We have over 100 folks registered for this webinar, so we're going to wait a few minutes for more folks to trickle in. Just hang tight, and we'll get started shortly.
Testing.
All right, well, why don't we go ahead and get started. Good afternoon, everyone. Welcome to ARCCA's learning session on advancing the climate health connection. This webinar is organized by the Alliance of Regional Collaboratives for Climate Adaptation, and we're excited to have a number of our partners here with us today to dive into this issue. My name is Julia Kim. I'm a project manager at the Local Government Commission. I'm serving as the coordinator for ARCCA, and I will be your moderator for this webinar. And a quick overview of today's agenda. I will provide a very brief overview of ARCCA for those of you who may not be familiar with us, and then to our feature presentation. We're excited to have Allison Crimmins with the U.S. Environmental Protection Agency here with us today. She'll be diving into the U.S. Global Change Research Program scientific assessment on the impacts of climate change on human health in the United States. And she'll be providing a background on the development of the report, highlighting the overarching messages from the report and describing some of the key findings in greater detail. Then following her presentation, you'll have the opportunity to ask questions regarding the report, and then we'll launch into a roundtable style discussion with, I gotta say, an all-star panel with us today, and we'll be exploring how we can advance the climate health connection in California with an emphasis on climate change adaptation and focusing on bringing you concrete strategies, tools, and resources to help in furthering your efforts. And participants are encouraged to ask questions throughout the webinar presentations. And a quick overview of, actually just webinar logistics super quick. Everyone will be muted except for our panelists, of course, and due to the large number of participants, we ask that you type your questions into the question box in the webinar control panel. We won't be using the hand raising feature just to avoid any technical difficulties that may arise. And please feel free to submit your questions at any point during the webinar. We'll be summarizing those questions during the Q&A portion, which will follow the presentation. And any questions we don't have time to get to, we'll be sending it out to all of our panelists after the webinar and sharing that with you as part of the webinar follow-up. We'll also be recording this webinar and sharing the link to the recording as well as a copy of the presentation and all the slides from today. All right, so what is ARCCA? ARCCA is a network of leading regional collaboratives from across California that work together to advance adaptation statewide and to increase local capacity to build community resilience. And through ARCCA, members connect with their peers across the state to exchange knowledge and tools, to engage in targeted problem solving, and to implement joint campaigns. ARCCA is working to advance effective and equitable adaptation by engaging in state policy development, facilitating dialogue between key decision makers and stakeholders, and creating resources to accelerate action on the ground. And our current membership consists of regional collaboratives covering the Sierra Nevada region, the Sacramento Capital region, the San Francisco Bay Area, the Los Angeles region, and the San Diego region. And together, these regions represent over 80% of the state's population. And this past year, ARCCA has also been engaged in working with the organizing committee of the Central Coast Climate Collaborative and providing some guidance around formation and governance. They should be getting established formally any day now, so stay tuned for that announcement. We're all very excited here at ARCCA. We also, of course, have the Governor's Office of Planning and Research serving as an ex officio member, and they have been tremendously valuable in serving as a channel between local and regional entities up to the state. So we're really grateful to have OPRs as part of ARCCA. And just to go over some of our current initiatives, ARCCA is currently supporting a couple of fourth assessment research projects, aiming to identify practical opportunities to overcome financial and institutional barriers to implementing local adaptation strategies. We're helping to put together a series of regional stakeholder workshops. We already held a couple in the San Francisco Bay Area and Los Angeles and before the California Adaptation Forum. Now we're gearing up for the month of October. We'll be hosting workshops in Sacramento, in Eureka, Truckee, San Luis Obispo, and San Diego. We're also conducting an online survey, and you can follow that link to complete it. We're really hoping to have local government staff in particular share about their experience. More information will be shared as follow-up. ARCCA tracks legislation, so on our website you'll see that we have a legislative tracking page, and we'll also be coming up with a fact sheet that's just a legislative update of key climate bills from this session, so keep an eye out on that. We're finalizing a white paper on exploring the connections between California's communities through ecosystems-based adaptation. This is really working to advance the urban-rural connection. It highlights a number of key strategies that we're promoting, and we'll be working on putting together a series of work groups to really create some action plans to advance this connection. Also developing an adaptation and action roadmap and toolkit, highlighting projects that are happening on the ground and really diving into the details around funding sources, key stakeholders engaged, some of the impacts from those projects and things that are getting planned. So keep an eye out for that. And of course, you can always learn more on our website. And now I'm excited to introduce Allison Crimmins, who will be providing an overview of the scientific assessment on the impacts of climate change on human health in the United States, which was released this past April. And as she presents, please feel free to ask questions through the webinar control panel, and I'll be facilitating a brief Q&A following her presentation before we launch into the discussion. Allison is the lead author and lead coordinator of the U.S. Global Change Research Program's assessment on climate change and human health. She is an environmental scientist in EPA's Office of Air and Radiation Climate Change Division and specializes in climate change risks and impacts. Prior to joining EPA, she worked at MIT's Joint Program on the Science and Policy of Global Change and has a Master of Science in Oceanography from San Francisco State University and a Master in Public Policy from the Harvard Kennedy School. Thank you so much, Allison, for speaking with us today.
Thank you for having me. Do I have control of the slides now?
Yes, you should.
Okay, great. Well, I will just launch right into it then. Let's see if I can go forward. I'll try to launch into it.
Allison, I can actually make sure you're moving ahead. Oops.
Okay. I think I went too ahead there. Okay, there we go. Start on this slide. Thank you. So yes, I'm here to talk about the climate and health assessment that was released last April. Just to start off with a little bit of background in case you're not familiar with the slew of acronyms that are about to come at you. This is a product of the USGCRP, which is the U.S. Global Change Research Program. And this is the USGCRP is a federation of 13 different agencies that are all tasked to look at global change issues. And they're also congressionally mandated every 4 or 5 years to put out a big national climate assessment, the NCA. The last one was the third NCA that came out in 2014. And so it was sort of this, you get this giant report, this 800, 900 page report, and then you wouldn't hear from them for 4 or 5 years. And so they wanted to move towards more of a sustained assessment process, so that much more current information and science was coming out in between these big pillars of the NCAs. And so as part of the President's Climate Action Plan, health was identified as a top priority topic to have one of these interim reports. So this report came out in between the 3rd and the 4th National Climate Assessment. And those national climate assessments have a chapter on health, but because it's so huge, it gets, the one chapter gets shrunk down to something like 10 pages. And we really wanted to expand that into a full-length assessment on its own. And so that was really the motivation behind developing this assessment. See if I can move forward here. Let me try, maybe my mouse is better than my keyboard. Okay. So here's a nice big slide of acronyms, but to give you a little background of the process, we started development of this report back in 2013. It's driven by a working group of the USGCRP, which is the Climate Change and Human Health Group, which has the loving acronym CHIG. And this group is co-chaired by CDC, NOAA, and NIH. And so along with those 3 agencies, EPA helped coordinate this report. And a lot of 2013 was spent really getting input from the public. We had a public forum. We were taking comments on our prospectus. And 2014 was spent actually writing the report. And you can see here, my 3rd bullet point, I mentioned that the report was written by over 100 federal employees from 8 different federal agencies, which sounds like it should be the start of a really bad joke. What do you get when you have 100 federal employees working on something? But it actually turned out really wonderful. We had these perspectives all across the government from very different worlds and backgrounds, from NIH, CDC, FDA, NOAA, NASA, even the Department of Defense and the VA. It made for a really well-rounded report. And so much of that writing was done in 2014, and then 2015 was spent doing multiple rounds of reviews and revisions. And so all of the papers that were cited in the report came from the peer-reviewed literature, but then the report itself underwent a peer review by the National Academies of Sciences. And it also went out for public comment again, and interagency review and clearance, so that in the end we could have this really gold standard, very, very robust scientific report that came out in April of 2016. Trying to move forward here. There we go. So just to give you a little bit of background about what's in and what's not in this report, you can see on the right I've put the table of contents there. And I just wanted to note 2 things really quickly about that table of contents. First, Chapter 7 is called Food Safety, Nutrition, and Distribution. And I just wanted to note that that's not a full food security chapter. So it doesn't cover things like the impacts of rising CO2 on crop yields or crop prices or international trade. And that's because those topics were covered by another special report put out by USDA in December of 2015. And that report is focused specifically on the climate impacts on food security. And so this chapter in our report focuses more on contamination in food and the impacts of rising CO2 on nutrition and extreme weather event disruption of food distribution. The other thing I want to mention in this table of contents is number 9, the populations of concern. This was something we got a lot of input from the public and around the different agencies on, that we really needed to handle this idea of vulnerable populations thoroughly in this report. And so we did this by including a section in each of the chapters above. So each of the chapters 2 through 8 have a section on populations of concern. And so, for instance, the water-related illness chapter has a section that highlights populations who are particularly vulnerable to water-related illnesses. And then we pulled it all together in the last chapter where we could go population by population. And I'll describe that more when I get to the slide on that chapter. So to talk a little bit about what this assessment is, this first half of the slide, it's much more than just pulling together all the literature. It's not just a book report where we've summarized everything. This type of assessment goes beyond that, and if you're familiar with IPCC type assessments, you're probably familiar with likelihood and confidence language. So whenever we make a statement in this report, a key finding, we also use the expertise of the authors to weigh how confident we are in that statement, and if it's a projection, how likely that finding is. And so because of that, it really goes beyond just a summary to draw a very clear line in the sand of how much we know at this stage. Where is the current state of the science? I also wanted to know in the bottom half of this slide what the assessment does not address. And you'll see in that first bullet point there that this assessment does not include information on mitigation, adaptation, economic valuation, and definitely no policy recommendations. And this was a very purposeful choice. We didn't actually want to endorse any sort of adaptive measures as being best practices or not. And we wanted to lay the scientific foundation of what we knew on both observed and projected impacts on health, so that others, including hopefully all the people on this phone call, can use that as a starting point to then base their mitigation or their adaptation work. So let me go to the next slide. I'm going to give just a quick overview of the top line messages of the report, and then I'll quickly go chapter by chapter and just give you an overview of what's in each chapter. I can't dig too deep because this, a 400-page report in 20 minutes, but just to give you a top line messages of the report, this first bullet point here says, climate change is a significant threat to the health of the American people. And that sounds very simplistic, but it's actually a really important statement to make very clearly, and harkens back to the last National Climate Assessment, which really found that climate impacts were happening right now and right here in the US. And as I'll talk about more when I get to the populations of concern, it's also happening to all of us. And so this is a right here, right now, to us kind of statement, that these threats are not something happening far off in the future to someone else in some far off land. The second bullet point talks about a finding of the report that climate change really affects health in two main ways. And the first is by exacerbating existing health threats. So for instance, if you live in an area where there are a lot of wildfires currently, climate change is expected to worsen those wildfires. And so we see those health impacts from those wildfires being exacerbated by climate change. The second way that climate change affects health is by creating new public health challenges. And I don't mean completely out of the blue, never heard of it before, new. What I mean here is that it's creating health challenges in new times and in new places where we haven't seen them before. So for instance, with Lyme disease, we're seeing that spread from the Northeast and occurring in places where we haven't seen it occur before. And also climate change is projected to bump up the starting point of Lyme disease onset. And so you're seeing it occur earlier in the year than we've seen it before. And so in this way, we're really seeing these public health challenges where we haven't previously, where and when we haven't previously experienced them before. The third bullet point is something I get asked a lot, well, what did this assessment do? How did we advance the science? And so I answer this question with three main ways. We've advanced the science in three main ways. And the first is that I think we've improved our ability to quantify certain health impacts, particularly in terms of increased mortality and morbidity from extreme heat and air quality impacts. We're better able to model some of those projected impacts. The second way is that we've made the connections from climate change to those climate impacts, to changes in your exposure to those impacts, to actually having a health outcome. So that whole link from climate change to a health outcome, we've broken that down in each of the chapters and described where we have more or less confidence in the science. And I'll show you that on the next slide. The third way that we've significantly advanced the science with this report is that I think we highlight some very well-studied but not very well-known impacts. For instance, I'll show you on the food safety chapter, we demonstrate how increased CO2 actually affects the protein to carbohydrate ratio of your foods and what those implications are for health. Likewise, we have a whole chapter on mental health, which I think can often get overlooked or sort of shoved into the world of extreme weather and disaster literature. But we wanted to really raise the issue of mental health to the status of a full chapter on its own. So my last bullet point here is that every American is vulnerable to the health impacts associated with climate change. And this really came out of our attention to the vulnerable populations from each of these health impacts. And we started looking at people living on the coast and people living inland. We were looking at urban versus rural communities. We were looking at impacts to children and impacts to working adults and impacts to pregnant women and impacts to the elderly. And you very quickly realize once you're looking at all these different populations that we haven't actually left anyone out, that every American is vulnerable to climate change. And so while, again, this is a very simplistic sentence, it's a really important message to take away from this assessment. So I'm going to quickly go chapter by chapter. I'll probably just spend a minute on each slide here just to give you an overview of what's included. And then you can feel free to ask me for more information or dig into the report yourself. The first chapter is our introduction chapter, which really sets the context for the rest of the report and gives you a quick 101 on climate change science, but also what are the underlying health trends that climate change will be affecting. So what do we expect to see in terms of obesity or COPD or Alzheimer's disease that then climate change acts on top of. And the picture I've shown here is of our exposure pathway diagram. And this is what I was talking about when I was saying we make the links between climate drivers through changes in exposure all the way to health outcomes. And you can see in the gray boxes on the right and left, we also talk about a lot of the other factors that can play a role in whether someone is exposed or whether someone gets sick. And so each of the chapters include a diagram like this. This is the overarching one, but each of the chapters include a diagram that gets much more specific about just one health outcome. So for instance, the vector-borne disease chapter has one on Lyme disease. And I think it can be kind of difficult for someone to think, how do you get from climate change to Lyme disease? And that's what this diagram is really meant to describe, how you walk through the steps from driver to exposure to outcome. Chapter 2, there we go, is on temperature-related death and illness. And this chapter looked at both extreme heat and extreme cold. And they found that the increase in heat-related deaths projected by the end of the century far outweighs the decrease in cold-related deaths, so that we're looking at an increase of thousands to tens of thousands of premature deaths in the summer by the end of the year, and that's each year. Interestingly, this chapter also found that small differences in seasonal average temperatures, so small changes from the norm, can result in a pretty large number of illnesses and deaths, particularly because it just happens more frequently than extreme heat waves. Chapter 3 is on air quality impacts, and this chapter covered outdoor air impacts, so particularly ozone and PM 2.5. It also looked at aeroallergens and then indoor air quality impacts. And so you can see here I've used a picture from the ozone findings, which map average daily maximum temperatures in the first column and how that affects the change. So rising temperatures make ground level ozone easier to form, how that affects the change in 8-hour maximum ozone, and then the projected premature deaths in 2030 in the summer from that excess ozone. And those numbers look pretty small, but that's actually by county. And so we see a pretty large increase in premature deaths, as well as things like asthma attacks, hospital visits, lost work or lost school days. Let me go to the next slide. Chapter 4 is on extreme weather events. And this chapter looked at extreme precipitation and flooding, looked at storm surge, wildfires, drought, and winter storms. And interestingly, this chapter also went a little further to think about those sort of secondary health impacts. So not just the health impacts that occurred during the storm, but the health impacts that occur before, during, and after, and sometimes long after an extreme weather event, and thinking about how climate change can disrupt power or water or transportation systems and the cascading health impacts that arise from that. Chapter 5 is on vector-borne diseases, and this chapter focused almost exclusively on Lyme disease and West Nile virus, and that was purposeful. We wanted to do one tick-borne and one mosquito-borne disease, and outside of Puerto Rico, those two diseases are really the most tied to climate change in the U.S. And dengue and chikungunya still have a lot of influence from travel outside of the U.S., but these two were can be much better attributed to climate change than some of the other vector-borne diseases at this point. And so you'll see here something I mentioned before, the spread of Lyme disease from 2001 to 2014. You're seeing this spread into new areas where this hasn't occurred before. I also mentioned that we are projecting Lyme disease incidence to occur a week or 2 weeks earlier by the end of the century. So this is one of those examples of seeing a health threat in new places and in new times because of climate change. Chapter 6 was on water-related illnesses, and I think this chapter did a really great job of connecting those dots from the climate drivers to the exposure to the health outcome, thinking about threats coming from our drinking water and from recreational water. And they dig really deeply into a couple specific regions. So they look at Chesapeake Bay and the Caribbean and the Gulf of Mexico. They look at Puget Sound and then the spread of Vibrio up into the Alaskan coast. This chapter also covered extreme precipitation and the threats that poses to some of our aging infrastructure and what that means when we have combined sewer overflows and water infrastructure failures. Chapter 7 was on food safety, nutrition, and distribution, and I already hinted at this one earlier, but I've highlighted the third key finding here, that rising carbon dioxide alters the atmosphere that our plants are growing in, and so alters the chemistry of those plants. So we're seeing a decrease in the protein to carbohydrate ratio in a lot of food crops like wheat and rice and C3 type plants. You're also seeing a decrease in a lot of essential minerals. So thinking about this into the future, this can have a very different impact if you're living in a place, maybe a developing country, where there are protein deficiencies, as opposed to someone living where there are obesity issues. That protein to carbohydrate ratio decrease is kind of a double-edged sword for those two health concerns. Chapter 8 is on mental health and well-being. And this chapter looked at, of course, the mental health impacts from extreme weather events, some acute and some chronic. It also identified a few other mental health impacts that I think aren't very well known or maybe just not talked about enough. But it looked at the threats that climate change poses to all of us just from seeing it on the news, from hearing it on the radio, from listening to someone from EPA give you a very depressing webinar, those sorts of mental health consequences that are constantly bombarding us. And also, I've highlighted key finding 4 because I think that's an interesting one too. People with existing mental health illnesses may be taking medication for that makes them more vulnerable to extreme heat. So less able to thermoregulate their own body temperature and putting them at more risk. And I think we can all sort of, think, you can relate to the idea that anytime you're physically ill, that affects your mental health. And so all of the previous health impacts that we talked about come into play when we're talking about climate change and mental health impacts. And so this is the last chapter, our populations of concern. It had the most authors on this chapter, the most public comments were on this chapter. It was the longest chapter, and we wanted to look at how changes in your exposure, changes in your sensitivity, and changes in your ability to adapt affect a person's vulnerability. And so this chapter dug into 7 different populations of concern. We looked at children, pregnant women, elderly. We looked at environmental justice concerns, including low income, English as a second language, and some minority groups. We also looked at tribal communities, occupational health, people with pre-existing health conditions, and people with disabilities. So that is the end of my content slides, but to leave you on a little bit of a higher note, let me just really quickly run through a couple of the resources we have available to help get the word out about this assessment and the findings of this report. The whole assessment can be found at health2016.globalchange.gov. And to give you a little insider tips, there's a couple icons in the top right corner. The one that looks like 3 dashed lines, or the hamburger menu one. If you open that up, you can skip to any of the chapters, but there's also a place where you can request printed executive summaries. That's the secret hiding place to request printed materials. The other icon there is the down-pointing downloads arrow, and if you click on that down arrow, it takes you to the downloads page where you can find all of the chapters. You can see them on screen or print versions. You can download the citations. You can see all of the figures. There's PowerPoint presentations that have all of the key findings and figures from the report. Our executive summary can be found here, which is also translated into Spanish. And since each chapter takes up 2 pages, we turned that into a front and back brochure for each of the chapters as well. So a lot of good resources on the USGCRP site. This is a picture of one of the figures from that site, and just to show you a couple more icons in the top right corner, that eyeball-looking icon will let you download the figure, and if you want to get really nerdy, you can see all the metadata of how that figure was created. And the little 3 connecting dots icon will let you share those figures through social media. EPA also has a series of resources based on the findings of the health assessment. So if you look at our website, epa.gov/climate-change/impacts, or just Google search us, you'll find this box in the bottom right corner that has several different resources available. The first is an online quiz that you can share via social media and challenge your friends. The second one is a clickable map, and if you click on any of these states, you can see some impacts that are relevant to that state and also some resources to help you prepare and respond to those climate threats. We've created 8 fact sheets for each of the populations of concern. We actually split out children and pregnant women since those are slightly different audiences. So we have 8 fact sheets available. Those are all within 2 to 4 pages long. And we've also translated those into Spanish, which are available on our En Español website. And then finally, we have an infographic that walks through all the different health impacts, all the different vulnerabilities that one would expect as you move through life. So starting from pregnant women, moving through infants and adolescents to adulthood, and finally with older adults. And so I will stop there. I've put the resources for both the USGCRP website and the EPA website. And maybe I'll just end with one more plug to check out the USGCRP website, which is just globalchange.gov. They actually are taking nominations for regional lead authors of the next National Climate Assessment. And the deadline for those nominations for authors is the 30th, so I think that's this Friday. So if you are interested in contributing to the next big national climate assessment, I really urge you to make those nominations now. And I'll stop there.
Great, thanks so much, Allison, and wow, what a wealth of information that you shared. I'm sure you could go hours diving into each of the chapters, and I want to invite our participants on the line to use the webinar control panel to send your questions in. We'll have a few minutes to dive into a brief Q&A before we launch into the regional discussion. And we already have a couple questions coming in. One being, does USGCRP work with other nations abroad to advance the climate health connection?
Yes, they do. I'm part of the Climate Change and Human Health work group, but there's actually an international work group that works on that. And even within our health work group, we have international work going on preparing for the big UNFCCC COPs, the Nairobi work program. There's definitely a lot of international collaborations with the World Health Association and all the post-Paris Treaty work going on.
Great, thanks, Allison. And we have one more question, and it's a bit policy-based, but we'll see if you have anything to add here. How can citizens put pressure on their government to create policies based on these findings?
That is a very good question. I'm thinking about how to answer that without getting myself in EPA trouble diplomatically. I guess I would point you to two resources on our website first. The first one, if you go to epa.gov/climate change, you can see that we have a what you can do page there, and we also have a what EPA is doing. And I think that's a good starting point for actions that people can take in their homes or schools or communities, but also having an understanding of what we're doing. And I think USGCRP has similar opportunities for engagement. You know, I think, to be frank and give you my personal opinion about it, people ask me a lot, what's the best thing you can do? I actually think that, you know, a lot of people think climate change is an impolite topic and not one to be talked about at the dinner table or, you know, with the cranky uncles over Thanksgiving dinner or the neighbors or things like that. And I actually think that, you know, just talking about it more, making it a normal part of our conversation and not something that's somehow political or not polite conversation, I think that's actually the #1 thing I would advise people to do. So talking with your friends, talking with your neighbors, sending letters, calling your state representatives, those are all great actions to just bring this more into the normal conversation. And this whole report is about health. And so it's really something that we all care about. It's, you know, it's not just polar bears and melting glaciers, which of course are important, but this is something we can all relate to, and it affects all of us. So I hope this report provides good ammunition to include these sorts of impacts that people will really care about into more conversations.
Great, thanks so much, Allison. We have one more question before we launch into the discussion. Can you talk a bit more about the techniques and inputs used to develop the findings? For example, are most based on modeling or observed data?
Sure. Each of the chapters have inputs that are both observed and projected, and it's really based on what's available in the literature. Beyond that, we also included some very recent studies that were being conducted around the government from different federal agencies, and this was research that was already underway, but we nudged it towards the finish line so that we could include it in this report. So it made it much more current than even the third National Climate Assessment, which just came out 2 years before this one. And so we include research highlights in our extreme heat chapter, our air quality chapter, our vector-borne and water chapter. And I have to admit that the state of the science is different for each of these health impact areas. So for heat and air quality, we're much further along in terms of modeling or projecting future impacts in a very quantitative way. For things like vector-borne, waterborne, foodborne diseases, we know that climate change will affect our risk, but we have less certainty in exactly how many people are going to get sick. And you can kind of intuit that. You know, we know climate change will affect the spread of ticks that carry Lyme disease, but it's much harder to say whether people will go outside more, or whether doctors in that area will diagnose Lyme disease more, or whether your behavior or adaptation changes will affect those projections. And so for some of these health impact areas, I think this report actually draws a nice starting point where I hope we can progress with our research, and maybe by the next time a report like this comes around, we'll be able to include some of those other chapters in the more quantifiable projection category.
Great, thanks, Allison. And I lied, I have one more final quick question.
No problem.
As a result of this report, what is the likelihood that federal funding for climate adaptation will be forthcoming?
Oh, I'm afraid I can't answer that one at all, and I think that might be up to the people on this phone call more than me. I really hope that this is the ammunition you guys need to ask for more funding, but I can't speak to whether that's likely or not.
Wonderful. Well, why don't we, that was actually served as a good segue. Why don't we go ahead and dive into the roundtable discussion. It's my pleasure to introduce, again, this all-star panel joining us today for a roundtable style discussion. David Rouse is the Managing Director of Research and Advisory Services for the American Planning Association in Washington, D.C. He is a Fellow of the American Institute of Certified Planners and a registered landscape architect with over 30 years of experience in community planning, design, applied research, and implementation. Thanks for joining us, David. We also have Elizabeth Rhodes, who coordinates climate change policy and programs at the Los Angeles County Department of Public Health, where she works to bring a public health voice to decision-making related to climate change. She is a department representative to county and regional climate change work groups, and she has also founded and leads the Interdepartmental County Climate Committee, that's a mouthful, which brings together various Los Angeles County departments to implement the county's Community Climate Action Plan. And next, we also have Judy Robinson here joining us live at LGC's offices today. Judy Robinson is a principal planner and the sustainability manager for Sacramento County. She has over 25 years of experience with local government, community planning, and development. She is the team leader for the Design for Active Sacramento, a cross-sector health team which does focused work on using the built environment to improve the public's health, and was instrumental in the adoption of healthy communities policies and zoning codes for Sacramento County. Design for Active Sacramento received national recognition for their work and is part of the National American Planning Association Plan for Health cohort. Judy is a recognized leader and expert on planning, health, and the built environment. Thanks, Judy. And lastly, certainly not least, we have Linda Helen, who is a team lead for the Climate Change and Health Equity Program of the California Department of Public Health Office and Health Equity. This program works with national, state, and other partners to embed health and equity into climate change planning and policy in California, and to embed climate change and equity into public health planning. Prior to joining the department, Linda spent 14 years at Mendocino County Public Health, most recently as Senior Program Manager for Prevention and Planning Unit, where she led her team to focus on reducing health inequities by training youth from underrepresented communities to be advocates for policy change in their neighborhoods, schools, and communities. Thank you, Linda, and thank you everyone for joining us today. And a quick reminder to our participants, please feel free to send any questions you have for our panel through the webinar control panel. And to kick us off, back to you, Allison. You talked through a lot of drivers and exposure pathways and health outcomes, but how can the average person use this assessment to improve their well-being?
Sure, yeah, I think the biggest takeaway I can give you, and hopefully the others on the phone can chime in with some more action items, is just knowing the threats and being prepared for what's to come, because we are seeing these threats happen at different times of the year and in different places. But it's also, you know, we've designed the report to go chapter by chapter. So there's a chapter on heat and a chapter on air quality and a chapter on vector-borne diseases, but that's not actually how people interact with these threats. These threats can all be happening at the same time, or they can be happening in a cumulative fashion over their lifetime. And so I think really knowing who's who's at risk, where these risks are happening, and when they're expected to happen, allows for better preparation and better adaptation planning.
Thanks, Allison. Any other thoughts from our other panelists? Maybe not this assessment in particular, but other plans and scientific assessments that are released. How can the average person really take these findings and change their behavior or do things that can improve their well-being?
So this is Linda from the California Department of Public Health. And I'll just jump in by saying that people can definitely do things on their own, like strive to walk or bike or take transit as much as possible rather than driving, carpooling, reducing energy use, consumption in general, things like that. And at the same time, this isn't just an individual problem. You as individuals did not create this, and it's hard to solve it on an individual level. So our perspective is that it's really essential for people to come together and use their power as citizenry and as residents to advocate for policy changes on the local, state, national, and international levels that will really provide resources, leadership, policies, regulations that ultimately invest in communities where there's some brilliant solutions going on and provide resources to improve equity and health and reduce climate change at the same time.
This is David Rouse. If I could pitch in quickly from a planning standpoint. So this kind of study, to me, is critically important to the work we do as planners and working with citizens to give evidence about things that are happening, objective evidence about trends that we can then take in the planning processes and develop plans and strategies and implementation based on evidence, because a lot of times we don't have the evidence available, and then that's when things tend to get controversial. So I think evidence-based from this study and others like it is critically important to advance planning for climate adaptation.
This is Judy. I think sometimes we think about climate change as happening someplace else or being this huge emergency event that also sometimes happens to other people. And what this does is it personalizes it. You know, just last summer, it was the first time Sacramento, actually the Sacramento River, had to be noticed for algae bloom that we'd never experienced before because the river was warmer than typical and people had to stay out of the water. And so whether it's local governments that are having to bring this to the light of the public, or it's the public that now is having to pay attention to the fact that, yeah, I have to start wearing some more mosquito repellent, and I need to be more vigilant in not having standing water around my house because it's not just a mosquito bite anymore. You know, it's some other disease that's really going to make me sick and have, you know, sometimes even greater ramifications. So, you know, I think this type of information and educating the public makes them, heightens their awareness and needs to be used in that capacity.
Great, thanks everyone. Well, now departing from the individual level and thinking more from the perspective of agencies, of local government, regional government, state government agencies, other types of institutions, what are some other tangible strategies that can be implemented or are currently being implemented on the ground to reduce the public health risk presented by climate impacts?
Yeah, this is Elizabeth from the LA County Department of Public Health. And, you know, in LA, I think one of our primary concerns is increasing extreme heat. You know, particularly since, like a lot of the state's coastal regions, we have a lot of homes without air conditioning. And I think, you know, one of the strategies we're pursuing to reduce the public health risks associated with increases in extreme heat is urban heat island reduction. So I think urban heat island reduction is really tangible because it involves trees, cool roofs, cool impermeable pavements, green spaces, and partly the fact that you can actually see those strategies be put into place, I think makes it easier to build momentum around them. So I lead this committee with different county departments working on an urban heat island reduction plan. So we're working with our County Department of Regional Planning, Public Works, Parks and Rec, Fire, and it includes those 4 component areas that I mentioned: trees, cool roofs, and cool impermeable pavements and green spaces. So, I think we can offset some of the warming that we're seeing with climate change by cooling down our neighborhoods using these strategies, and that, of course, helps prevent direct heat-related illness and death, as well as, the excess ER visits and the hospitalizations that we see during extreme heat events. But also, kind of in a more general sense, I think it gets at equity issues, of course, because low-income communities and communities of color are much more likely to have a strong urban heat island effect and be very tree poor. And I think it gets to also general kind of well-being in terms of creating environments where it's, more comfortable for people to be outside and to be physically active outside. So, I think particularly by focusing tree planting and the other strategies in kind of our more underserved communities, we're helping to create healthier and more, climate resilient and more equitable communities.
This is David Rouse. If I could add to that, I totally agree, and also just to expand a little bit, at APA and planners in general and related professions are really looking at this concept of green infrastructure and co-benefits, and obviously tree plantings are key to public health, reducing the heat island effect. But you think of the other benefits that a network of green spaces, greenway corridors, green streets, street trees can provide in terms of public health, also stormwater mitigation, during flooding events, extreme weather, air quality, water quality amelioration. So that's sort of a comprehensive strategy that we see a lot of communities doing. Philadelphia, Pennsylvania has been a leader in green infrastructure to address a combined sewer sanitary overflow situation, but in doing so, they actually did a cost-benefit analysis of the return on investment. Then they quantified things like reduced deaths from urban heat island effect and showed a 2.2 to $1 return on investment on a $1 billion over $1 billion over 20 years, so $2.2 billion. So thinking broadly about how green infrastructure approaches can promote public health and address, I think, a lot of the factors we just talked about is another thing that I see being done around the country.
That's a great example, David. Oh, go ahead, Judy.
No, go right ahead, Linda.
I was just going to say that another example of a solution that solves multiple problems is investments in weatherization and energy efficiency for low-income housing and for folks in low-income communities. These can remedy dangerous housing conditions like mold and dampness. It can help reduce the risk of heat illness during extreme heat events. It can save families money and lower greenhouse gases through energy savings. And so there are programs like through the California Department of Community Services and Development. They provide funding and folks in nearly every community that can help identify homes and families to receive those kinds of services.
One of the strategies that, Sacramento County and Design for Active Sacramento has done is to really push forward active transportation. It's walking, biking. It's a lot of the landscaping that David referenced, but it's also the intersections of land use, transportation, and health, and utilizing health as the lens as we develop our policies, as we do our design guidelines, as we adopt our zoning codes and other general plan policies. And then leverage other initiatives that are underway. There's Caltrans dollars for bike and ped improvements, but the funding from Caltrans and from some of the other state grants really should be going into all of these types of infrastructure improvements that have been mentioned by folks on the panel, that not only just reduce greenhouse gas emissions and help with carbon reductions, but create spaces and places where people want to be, where they want to walk, where they can interact with each other, where they can socialize, where there's destinations where they can go to. So it really is a way of placemaking making communities and neighborhoods places that are very, very desirable, places that we already know what they look like, but we really need to be retrofitting our existing communities and making sure that our new communities plan with these particular strategies in place. And I'm glad to see that the regional transportation guideline is considering transportation and health and their work going forward, as well as the Air Resources Board and their scoping plan for the new climate adaptation plan or climate action plan, looking at transportation and incorporating health across all of these areas. We just have to lead with health in all of these conversations and keep it at the forefront.
Judy, I'm glad you brought that up. And as long as we assure that our investments in walkable, bikeable, transit-oriented, compact, livable communities also have measures to prevent displacement and help existing residents stay in their homes and have those be affordable, then we can avoid unintended consequences with our climate change investments. And so I think a possible strategy on the state as well as the regional and local level is to assure that all major decisions, plans, and investments consider climate change and promote health and equity. And so, for example, the Governor's Executive Order B3015 requires that all state agencies take climate change into account in their infrastructure investment. And we at CDPH are convening an advisory group to help write guidance for state agencies to promote equity and health for vulnerable populations as agencies implement that executive order.
Yeah, affordable housing is, I mean, people think about, well, affordable housing, what's that got to do with climate change or climate adaptation? Well, it's right in the middle of it all. And that's something when you take a look at an affordable housing project and where it's located and the access to services and goods and transit and walkability, it incorporates all of these different things that really helps to heighten, you know, the success and the livability of its residents and then the surrounding community.
Yeah, and I think an important, perhaps common factor to all these successful initiatives is genuine community engagement and really providing robust, meaningful opportunities for community folks and other stakeholders to understand the programs, to provide input for them, to have buy-in into them, and actually have a role in implementing them, and then they'll be most successful. One example is the California Natural Resources Agency is leading a process in which the Department of Public Health is participating, supporting environmental justice and health equity leaders from around the state to provide climate justice recommendations for the 2017 update of Safeguarding California, the climate change adaptation strategy for the state. And this working group will also develop climate justice principles and recommendations for broader California climate change adaptation. And that can be a model for other agencies and initiatives as well.
Great. I know we just have a few minutes left, but there are a couple questions coming in from the audience that I'd love to address. Elizabeth, I know you mentioned that you have another meeting, and if you have to drop off early, just wanted to thank you so much for joining us today. We have a question from a participant. You know, throughout this webinar, we haven't really been able to dive into or consider the private sector. So he's wondering if we could chat a bit about the challenges and opportunities of getting the private industry involved in developing and implementing solutions.
Well, this is Judy, and I'll just get the dialogue going. In Sacramento, we have a nonprofit organization called Valley Vision, and they actually have a business resiliency program where they've visited with businesses and they've put on different workshops on trying to encourage business to, you know, get ready and how are you prepared and how do you, you know, back up your information so that your business is not as impacted or lessens the impact and burden of different climate effects. And while it's an awesome program, businesses have been reticent to get engaged with it, and oftentimes what the disconnect is that with small businesses, they don't own the building they're in, so there's not a lot of incentive for them to start making energy efficiency improvements or doing, you know, other certain things that are that would otherwise, you know, lower their energy use and lower their carbon footprint, and a lot of small businesses are just barely getting by. So the notion that they're going to have to do additional work to get ready, and I think also just some of the it's not going to happen to me kind of thing, really impairs particularly small business owners to really get on board and look at this and look at what those potential impacts might be even to their employees. So I mean, I think it's a challenge, but at the same time, we've got a brand new arena that's going in, and it's LEED Gold, and they're doing all kinds of offsets as far as their carbon footprint and all is concerned, and encouraging walking and biking and use of fresh food. So.
I could add on just quickly. Yeah, in the real estate market, LEED was kind of this out there thing, 5-10 years ago. Now, certainly in big metropolitan areas, it's become the standard that's expected. So you'll see that all developers adopting LEED principles. And going back to the idea of business, it's really in businesses' interest to deal with these issues. I mean, post-disaster recovery for businesses, disruption of supply chains and all that kind of stuff is very, it's a difficult issue. And I think I agree with Judy that small businesses have difficulty coping with, but I think there's an awareness generally, and there's resources and planning being done out there for businesses to cope with that. Also, just generally health and resilience of employees, a huge issue for businesses. So unhealthy employees is bad for business. So that certainly, I think the motivation is there for the private sector to actively engage. I think, as Judy says, the key is to find ways to engage them in these efforts.
Hi, and this is Allison again. I just wanted to note that I was speaking at a conference just a couple weeks ago in the Midwest, and all the people on the panel were actually worked in hospitals. And they were thinking about ways of reducing their emissions from energy use, water use, food waste. There was a woman there from the Mayo Clinic, and they serve 10 million meals a year. And so thinking about how to reduce food waste, and architects thinking about how to build hospitals better. And it was really interesting to think about this sort of private sector working on climate change issues, because in developing this report, we really have this interesting overlap between the climate change world and the health world, and without really waiting for anything, without waiting for a regulation or waiting for a established partnership, a lot of these hospitals were taking the steps to protect their own patients and protect their own employees as well by reducing their own greenhouse gas emissions.
Great. Just a couple more questions. I promise we won't go too over the time. One for you, Linda. I know you're working a lot at the nexus of climate, health, and equity. I mean, working at the Office of Health Equity. Would you be able to talk a bit more about the state's role in advancing the climate health equity connection?
Sure, thanks. Well, as Allison said, that incredible document she talked about provides the evidence but not recommendations. And I think the state has a responsibility to provide leadership, policies, regulations, and resources to improve living conditions in ways that reduce emissions, improve health and equity, and build resilience. And so we really see that the capacity for climate resilience is significantly driven by living conditions and the forces that shape them, like income, education, housing, transportation, and access to services. And so we need to invest heavily in strategies such as alleviating poverty, increasing access to opportunity and jobs, improving living conditions, and reducing inequities to have more climate resilient communities. And the state can lead on that, can provide targets and metrics and tools and data and regulations and incentives. And so for one example, our California Building Resilience Against Climate Effects program developed climate and health profile reports for all 58 California counties, forecasting climate impacts and health risks, and developed vulnerability assessment reports for 11 counties that characterize locations and communities vulnerable to climate impacts. And these can help locals prioritize resources and planning to reduce health impacts from climate change. We can also provide support for communications. Another example is our campaign in collaboration with the San Luis Obispo Public Health Department called Outside and Slow, and it was a public health and climate change campaign that focused on the co-benefits of those activities we can do that reduce greenhouse gas emissions and improve health, like walking and biking, like reducing our consumption, like buying local produce from the farmers markets. And then also banding together collectively to advocate for changes. And so there's a lot of money right now associated with climate change and climate policy through the Greenhouse Gas Reduction Fund that comes from cap and trade dollars at the state. And we can assure that grant applications for climate dollars ask questions about public health benefits, equity, environmental justice, community engagement, and anti-displacement measures. And guidelines for programs and requirements, such as the general plan guidelines, can and soon will encourage cities and counties to promote health and equity through their general plans. We can provide technical assistance to communities to implement solutions and apply for grant funds. And in short, we can just use the power of the state to set targets, inspire, or compel action, since we're obviously running out of time to both prevent catastrophic climate change and to adapt to the changes already here, as demonstrated by the first official climate refugees in the U.S. that happened this year. A Native American tribe located in coastal Louisiana had to be relocated entirely because their land is disappearing because of rising sea levels and flooding and storms. And so I think that we have a lot of inspiration and resources, especially in the state of California, and great partners at the local level to move forward.
Great. I think we have the time for just one more question. And considering that this is a webinar for ARCCA members, folks who are adaptation practitioners across the state, how can adaptation planning efforts and implementation efforts better integrate health considerations? And David, I know you touched a bit on green infrastructure, on the importance of having objective scientific assessments, but are there any other words of advice or frameworks you can provide?
Well, actually, I don't know if this directly answers this question, but I've been thinking about this over the course of this webinar, and there is a framework that the Rockefeller Foundation developed through their 100 Resilient Cities initiative, which I think many folks are familiar with, and there are some California cities. I think Berkeley is one of them, if I'm not mistaken, and probably others. But they have this concept called stresses and shocks. So there are chronic stresses that erode kind of sort of community health and well-being, and we know some of them that social determinants of health, but there are also shocks, events that happen that exacerbate these and create crises. So actually, obviously, if you think of climate change, you know, extreme weather events are one, earthquakes could be another, but also climate change contributes to these stresses as well. If you think about, for example, you know, rising temperature over time. So it's creating vulnerabilities that some of the populations that Allison talked about are especially vulnerable. So I guess, you know, just broadly, it's thinking through from a public health perspective, you know, what are the social determinants of health, things that make populations more or less healthy, and then what are the leverage points at which you can affect, sort of move the needle on those proactively, working with planners, because I'm a planner, and planning processes. So for example, how can you reduce vulnerability, you know, within designated hazard zones? I mean, that's an obvious one, get people out of harm's way. But beyond that, you know, we talked about green infrastructure earlier. How can you, you know, work, you know, poor populations, underserved populations are documented to have less access to green space and green resources than others. So how can you provide those kind of investments and work with communities to provide those types of resources that will help address urban heat island effect, that will, you know, deal with water and air quality, bring the mental health benefits. So that's sort of a general question, and I guess what I'm saying is think more upstream about these things, and then that will help you plan and adapt moving forward as you think of what your risks are.
Great. Thank you so much, David, and thank you to all of our panelists. We're about 10 minutes over, and I think that's sufficient time to go over. Yeah, I just want to thank everyone again for being able to join us today for this webinar. To learn more about ARCCA, feel free to visit us online at arccacalifornia.org, and feel free to, of course, reach out to me, Julia Kim, through the contact information listed above. If you have additional questions for any of our panelists, feel free to email that to me, and we'll make sure everything gets addressed in the follow-up. Our next webinar will focus on equitable and just adaptation, and it will likely take place sometime in November. So keep an eye out for an invitation from us on that. And that concludes our webinar. Thank you so much, everyone, for joining us today.
Thank you.
Thanks, Julia.